This is one of my favorite success stories that I love to share with people because it is all about something so simple that can make such an impact on your life. It's kind of like those commercials you see on TV, like, "I took this pill and then amazing things happened." But this is real life, and this guy's actual name is Gary, and he was someone who suffered with knee pain for many years. He tried everything: medications, steroid injections, physical therapy, and nothing really helped him. He was even considering knee replacement surgery, and he had actually gotten to the point where he was willing to do this surgery because his knee pain was just getting in the way of his daily life. He couldn't walk very far. Going up and downstairs was a challenge. Sitting in a chair for any length of time was difficult because he would have a hard time getting up. The pain was not constant. Sometimes it would feel better. Sometimes it would flare up. But overall, it was just there all the time, just kind of nagging at him. And then his doctor recommended that he try adding in flaxseed oil to his diet, which is a type of omega-3 fatty acid. And he did this, and within 2 weeks, his knee pain went away. Now, keep in mind, when he did this, he wasn't doing anything else differently. So the only thing that changed was the addition of this one thing. Now, he continued to take the flaxseed oil because he didn't want the knee pain to come back. But over time, he started noticing other things happening in his body that were pretty amazing. He noticed that his neck, which had always been stiff from past injuries, started to loosen up and feel better. His shoulders rolled down his back. And this was something that hadn't been able to do for decades. His hands started to feel better. He had less stiffness in his fingers. His eyesight improved. His hair grew back. His skin looked better. And he also noticed that he had more energy. So what happened to Gary? Why did his body start to heal and feel better? Well, there are several reasons. And the first reason is that flaxseed oil is high in alpha-linoleic acid, or ALA, which is the precursor to two important molecules called EP and DHA. These molecules are what I like to think of as the key to unlocking the benefits of omega-3 fatty acids. And here's how it works. So when we consume plants that grow in the soil like flaxseed, chia seeds, walnuts, and certain types of fish like salmon, sardines, and mackerel, these foods contain ALA, which is a precursor to those key molecules, EPA and DHA. So when we eat flaxseed, our bodies will convert some of that ALA into these key molecules, EP and DHA. However, this conversion process is not very efficient. Our bodies can only convert about 15% of that ALA into EPA and DHA. This means that if you consume 100 milligrams of ALA, only 15 milligrams of that will be converted into EPA and DHA. Now, EPA and DHA are the active forms of omega-3 fatty acids. They are anti-inflammatory, meaning they help reduce inflammation in our bodies. Inflammation is at the heart of most chronic diseases, including arthritis, heart disease, diabetes, and autoimmune disorders. So EPA and DHA help reduce inflammation in these conditions. They also support brain health, cardiovascular health, and healthy aging. EPA and DHA are also involved in the production of certain hormones that regulate inflammation, such as prostaglandins and leukotrienes. By increasing the levels of these hormones, EP and DHA can help reduce pain and inflammation. One of the ways to increase EPA and DHA levels is by consuming fatty fish or by taking fish oil supplements. However, this can be expensive and some people may not like the taste of fish or have difficulty swallowing the pills. This is where flaxseed oil comes in. Flaxseed oil is a plant-based source of ALA, which can be converted into EPA and DHA, although the conversion rate is not very efficient. As I mentioned before, it can still be beneficial for people who cannot or do not consume fish. Additionally, flaxseed oil contains other beneficial nutrients such as fiber, lignans, and phytosterols. Fiber can help improve digestion and lower cholesterol levels. Lignans are phytoestrogens that have been shown to have various health benefits, including reducing the risk of certain cancers and improving bone health. Phytosterols are compounds that can help lower cholesterol levels and reduce inflammation. Now, I should mention that while flaxseed oil is generally safe for most people, there are a few exceptions. People who have a fish or seafood allergy should avoid flaxseed oil as it may contain small amounts of fish protein. Flaxseed oil is also high in omega-3 fatty acids, which can increase the risk of bleeding. So people who are taking blood-thinning medications, such as warfarin or aspirin, should use caution when taking flaxseed oil. Additionally, pregnant women and nursing mothers should also avoid flaxseed oil as it can increase the risk of bleeding in both the mother and the baby. Now let's get back to Gary's story. When he started taking flaxseed oil, he was not doing anything else differently. So the only thing that changed was the addition of this one thing. And after 2 weeks, his knee pain went away. Now, this could have been due to several factors. First, the anti-inflammatory properties of the omega-3 fatty acids in the flaxseed oil may have helped reduce the inflammation in his knee joint, leading to a decrease in pain and stiffness. Additionally, the lignans in flaxseed oil have been shown to have anti-inflammatory and analgesic or pain-relieving effects. These compounds may have contributed to the overall improvement in Gary's knee health. Furthermore, the fiber in flaxseed oil can help improve digestion and reduce gut inflammation, which has been linked to other inflammatory conditions such as arthritis. Another possible explanation for the improvement in Gary's knee pain is the placebo effect. This is when a person experiences a benefit from a treatment, but only because they believe that the treatment will work. In Gary's case, he may have believed that the flaxseed oil would help his knee pain, and this belief alone may have led to an improvement in his symptoms. It's important to note that the placebo effect is a real and powerful phenomenon that can lead to significant improvements in health outcomes. In fact, many studies have shown that the placebo effect can be just as effective as medication in treating certain conditions. Despite the uncertainty regarding the exact mechanism behind the improvement in Gary's knee pain, one thing is clear. His symptoms did improve, and he was able to find some relief without having to resort to surgery or other treatments. This is a great outcome, and it highlights the potential benefits of trying alternative therapies such as flaxseed oil before considering more invasive treatments. Now, while Gary's experience with flaxseed oil is anecdotal and more research is needed to confirm these benefits, there are several studies that suggest that omega-3 fatty acids may help alleviate arthritis symptoms. A study published in Clinical Rheumatology found that supplementing with omega-3 fatty acids, including EPA and DHA, led to a significant reduction in pain and inflammation in people with rheumatoid arthritis. Another study published in the Journal of the American College of Nutrition found that increasing the intake of Omega-3 fatty acids was associated with a lower risk of developing rheumatoid arthritis. Additionally, a meta-analysis published in British Medical Journal concluded that supplementing with omega-3 fatty acids was effective in reducing pain and improving physical function in adults with osteoarthritis. These studies provide some scientific support for the use of omega-3 fatty acids, such as flaxseed oil, in managing arthritis symptoms. However, it is important to note that not all studies have shown positive results, and more research is always needed to confirm these findings. In conclusion, Gary's story is an inspiring example of how a simple change in diet can lead to significant improvements in health. While more research is needed to fully understand the benefits of flaxseed oil and other omega-3 fatty acids, it's clear that these types of healthy fats play an important role in reducing inflammation and supporting overall health. By incorporating flaxseed oil or other omega-3 rich foods into your diet, you may be able to experience similar benefits that Gary did, including reduced pain and inflammation, improved joint health, and a better quality of life. Of course, it's important to consult with a healthcare professional before making any significant changes to your diet, especially if you have any underlying health conditions or are taking medications. With the right guidance, you can safely incorporate flaxseed oil into your diet and potentially unlock a host of health benefits.